Hello everyone, my name is Mahmoud Ismail. I'm one of the cardiology fellows at Mayo Clinic, and today I'll be talking about our research evaluating racial and ethnic disparities in the use and outcomes of tricuspid valve surgery. So just quick background, tricuspid regurgitation affects approximately 2 million patients in the US, with a significant portion of them experiencing coexisting cardiovascular morbidities, such as aortic stenosis and mitral regurgitation. We know from previous studies that elderly patients with TR suffer from recurrent hospitalizations, prolonged hospital length of stay, in addition to increased mortality. And given the morbidity and mortality associated with TR, tricuspid valve surgery, including both replacement and repair, have increased in frequency with the goal to restore physiologic valve function and improve survival. We know that racial and ethnic disparities in outcomes exist following many cardiac procedures. However, the outcomes of tricuspid valve surgery by race and ethnicity remain unknown. So the goal of the study was to evaluate for racial and ethnic disparities in the use and outcomes of tricuspid valve surgery. We analyzed the National Inpatient Sample Database in the US from 2016 through 2020 to identify hospitalizations for tricuspid valve surgery. We used logistic regression models to determine racial and ethnic disparities in tricuspid valve surgery outcomes, and our primary outcome was all-cause in-hospital mortality, and our secondary outcomes included complications such as heart block, the need for permanent pacemaker, prosthetic valve dysfunction, stroke, acute kidney injury, major bleeding, the need for blood transfusion, and vascular complications. We also evaluated the length of stay and total costs. So between 2016 and 2020, we identified approximately 19,400 patients who underwent tricuspid valve surgery, of whom 74% were of white race, 11.4% were of black race, which is slightly lower than the relative percentage in the US population, which is approximately 12.6% according to the US Census data, and only 7.5% were of Hispanic ethnicity, which highlights the significant underrepresentation of Hispanic patients in tricuspid valve surgery compared to their relative percentage in the US population, which is approximately 18.7% according to the US Census data. After adjusting for multiple demographic and clinical factors, we found that the outcomes were pretty much similar between Hispanic and white patients and black and white patients undergoing tricuspid valve surgery. We found that the length of stay was similar between Hispanic and white patients. However, the length of stay was higher in black patients compared to white patients. We also found that the total costs were higher in both Hispanic and black patients compared to white patients. So to conclude, among patients who underwent tricuspid valve surgery in the United States between 2016 and 2020, black and Hispanic patients were underrepresented but had similar in-hospital clinical outcomes compared to white patients. Therefore, strategies to identify and correct the reasons for underutilization of tricuspid valve surgery and underrepresented minorities are very needed. Thank you very much for your time, and I look forward to your questions.